Hi guys, Dr. McGrath. Good Tuesday to you all. There's a couple of questions that got forwarded to our site. Simple, straightforward things that I thought I'd take a few minutes and try to answer to the best of my ability. There's a question that came in that asked, how likely is hair fallout after a procedure, and what sort of things can you do to avoid it or help upkeep your hair? Of course, we're discussing with the transplant procedure. Well, the answer to that question is not complicated, but it depends on a couple of things. For example, when we do a hair restoration procedure, we'll always tell the patients that after the procedure, you can expect that the transplanted hair is typically going to shed. It's going to fall out. That's normal. There's a very small percentage of patients where some of the hair will start growing right away, but that's not the expectation. The norm is that the hair is going to shed and is going to fall out. I think a more important question, and I think what the real question was from this particular person, is what's going to happen to the existing hair in the area if you're transplanting? Could you lose more hair? Could you go through what we call shock loss? And the answer is yes, you certainly could. But it's somewhat dependent on how strong the hair is to begin with, number one. And number two, whether or not you're using anything to protect your hair, like finasteride, minoxidil, etc. Obviously, having a good diet, biotin, things of this nature, a good, decent shampoo. I personally have never been a big lotions and potions guy, but I also look at hair and I grade it on my own system from 1 to 10. So if I'm doing surgery on a patient and their hair is strong, like a 9 or a 10, I don't really worry much about shock loss. When you have to start getting nervous is when you're working on a patient that's got very thin, fine hair, or if you're getting too aggressive and trying to move too many grafts. Those are some things that can lead to a little bit of trouble. But generally speaking, if you're working in a particular zone and there isn't a lot of hair to begin with, you're not really that concerned about shock loss. If you're working with a patient that's got a lot of diffuse thinning, those are the patients that I'm typically going to try to optimize their situation before we take them to surgery. So it may sound like a double-edged answer. It's not meant to be, but a lot of it depends on the strength of the donor hair, as well as the strength of the hair in the region where you're transplanting into. So I've often said, the success or failure of a hair transplant procedure is largely predicated on the strength of the donor hair. So the stronger the donor hair, the greater likelihood you're going to have a nice result. And I hope that answers your question. Number 2, can having a baby cause alopecia? Well, that's a very interesting question. I presume you're talking about for mama. Although having a baby can be stressful, and maybe the father loses hair too because of stress. But it's not unusual that we do see in a lot of our female patients that post-pregnancy and in the weeks, months that follow, that they do get and can go through what we call a telogen effluvium, or a temporary thinning or massive loss of hair. It doesn't happen to everyone, but it can happen. And it has to do with the hormone fluctuation. Obviously, when a female is pregnant, she's got a ton of estrogen and the hair is always looking good. We always say estrogen is your friend. And then of course, after they give birth, their estrogen drops, their progesterone's through the roof, and they're working, their hormones are working to normalize. If the mother's breastfeeding and their prolactin levels are high, usually their estrogen levels will stay rather high, and that sometimes can help with the hair. But yes, that can happen. It doesn't happen with every woman, but it's not uncommon. So yes, I guess the answer is yes, it can, but it's more of an androgenic or an immediate shock loss or telogen effluvium type of hair loss. I hope that answers that question. The last question I have here is, does having CCCP stop you from having a procedure. What we're referring to in general is a scarring alopecia. Central centrifugal scarring alopecia, generally speaking, is something I would not operate on. There are exceptions to that. There are occasions when a patient has had maybe a small case of CCCP and it's burnt itself out. Generally speaking, we like to look at about 18 months of acquiescence where there's been no hair loss or inflammation. But even then, I would probably send a patient for a biopsy to see if there's any active inflammation going on. As a general rule, it's not something that you want to transplant into. There have been some success stories, of course, and I've had a few. My good friend, Dr. Tutu in New York, she's probably the leading expert on this, and she'll always tell you, even if you think for sure it's quiet, get a biopsy. So I think being cautious is important, but having a central scarring alopecia is not something I'd be in a rush to transplant into. So I hope that answers that question. Keep the questions coming. It keeps me on my toes. I enjoy it. And if there's anything I can do better in answering your questions, let me know. But just try to give you the straightest, most up-to-date information that I can find. We usually keep this pretty informal, but I hope it helps. So have a great day, and we'll talk to you soon.